Somewhere in a hospital right now, a doctor is about to tell someone that they have maybe a year left. Somewhere else, a 95-year-old is doing yard work before breakfast. Same species, same planet, wildly different outcomes. For decades, we were told the gap between those two lives came down to genetics, luck of the draw. But that's not what the last 20 years of medical research actually shows. It comes down to about 10 habits. Most of them take less than 10 minutes a day. None of them are eat your vegetables. You already know that one. This is the science nobody put in one place, until now. I'm not going to tell you to exercise more or eat healthier. You've heard that 10,000 times, and it's never specific enough to actually act on. Instead, we went through the actual studies, the ones published in journals like the Lancet, JAMA, and Nature Medicine, to find the highest leverage, least talked about habits in modern medicine. 10 tips, real research behind every one. Let's start with the one that quietly predicts your lifespan better than almost anything else your doctor measures. Tip 1. Grip strength and muscle, the body's hidden scoreboard. In 2015, researchers published one of the largest studies ever conducted on human health, the PURE study, following nearly 140,000 people across 17 countries. They measured dozens of health markers: blood pressure, cholesterol, activity levels. The single strongest predictor of death from any cause wasn't blood pressure. It was grip strength. A simple handshake strength test outperformed systolic blood pressure at predicting who would die and who wouldn't, across every income level, every region, every culture studied. Why would squeezing your hand matter that much? Because grip strength isn't really about your hand. It's a stand-in for your total body muscle. And muscle isn't just for looking strong. It's one of the most metabolically active tissues you have. It regulates blood sugar. It supports your bones. It fights inflammation. Here's the part that should worry you a little. Starting around age 30, most people lose 3 to 8% of their muscle mass every single decade. And that decline speeds up after 60, quietly, without symptoms, until suddenly a jar lid is hard to open, or a flight of stairs leaves you winded. Action step. You don't need a lab. Try this. Open a jar, carry both grocery bags in one trip, do a dead hang from a bar for as long as you can. If any of these feel harder than they did 5 years ago, that's your body telling you something measurable is changing. The fix isn't complicated. Resistance training, twice a week, is the single most effective intervention we have for reversing this. But muscle is only half the picture. The other half is a number almost no doctor actually uses, and it might matter more than the number on your bathroom scale. Tip 2. Waist to height ratio. The number your scale can't show you. Here's something that should change how you think about your own body. Two people can have the exact same BMI and have completely different health risks. BMI only knows your height and weight. It has no idea where your weight is sitting. And that turns out to matter enormously, because fat stored around your waist, visceral fat wrapped around your organs, behaves completely differently than fat stored elsewhere. In late 2025, researchers from the University of Pittsburgh followed over 2,700 adults with no heart disease at the start of the study. They tracked BMI, waist size, and waist-to-height ratio. Once they adjusted for the usual suspects, smoking, blood pressure, cholesterol, only one measurement still predicted future heart disease: waist-to-height ratio, not BMI, not waist size alone. The ratio between the two, and the predictive power was strongest in people whose BMI was under 30, people a doctor might glance at and call fine. Action step: grab a tape measure. Measure your waist at belly button height. Divide by your height in the same units. Research generally points to under 0.5 is the healthy range, 0.5 to 0.6 is worth paying attention to, and above 0.6 is a signal to talk to a doctor. A 5'10" person, that's about 178 centimeters, should aim to keep their waist under 89 centimeters or about 35 inches. Now, knowing your risk is one thing. What you actually do after a meal turns out to matter just as much. And the fix here takes 10 minutes and costs nothing. Tip 3. The 10-minute walk that beats the 30-minute walk. For years, the standard advice was, walk 30 minutes, most days of the week. Good advice, but for most people, totally impractical to do after every single meal. So in 2025, researchers in Japan ran an experiment. They had participants drink a glucose solution, then tested 3 conditions: sitting still, walking 30 minutes starting half an hour later, or walking just 10 minutes, immediately. The immediate 10-minute walk was the only condition that significantly blunted the peak spike in blood sugar. Here's why that matters beyond just feeling sluggish after a big meal. Those after-meal blood sugar spikes are linked to oxidative stress that, over years, damages blood vessels and is associated with higher long-term cardiovascular and even cognitive risk. You don't need a diabetes diagnosis for this to apply to you. This is true for healthy adults too, and the walk doesn't need to be fast. The study's participants walked at a relaxed 2.4 miles per hour. This is not a workout. This is a stroll. That's what to do right after you eat. But there's a habit operating in the background of your entire day that turns out to predict death risk better than how many hours you sleep. Tip 4. Sleep consistency beats sleep duration. Do you sleep 8 hours a night? Do you go to bed and wake up at roughly the same time, every single day, weekends included? Most health advice obsesses over the first question. The science says the second one might matter more. In 2024, a study published in the journal Sleep analyzed over 10 million hours of sleep tracking data from nearly 61,000 people in the UK Biobank. Researchers built something called a sleep regularity index, essentially a consistency score for your sleep-wake timing. Then they tracked who died, and from what. The result? People with the most regular sleep schedules had a 20 to 48% lower risk of dying from any cause than people with the most irregular schedules. And this effect held up even after accounting for how many hours people actually slept. When the researchers compared the two factors directly, sleep regularity came out as the stronger predictor of mortality, not duration, regularity. A separate study presented the same year went further. People who slept enough and kept a consistent schedule had a 39% lower mortality risk compared to people who were both irregular and short on sleep. Your body runs on rhythm, not just rest. Constantly shifting your sleep window, weekday alarm, weekend lie-in, time zone hopping, confuses the internal clock that regulates everything from hormone release to immune function. Action step: pick a wake-up time. Use it 7 days a week, yes, including Saturday. Consistency is the lever here, more than chasing a perfect 8 hours. Sleep happens alone, in the dark, doing nothing. The next habit is almost the opposite, and the research behind it is honestly a little unsettling. Tip 5. Loneliness is a measurable health risk, not just a feeling. Here's a habit that has nothing to do with food or exercise, and a growing pile of research says it might matter just as much as both. A massive meta-analysis covering 70 separate studies found that social isolation was associated with a 29% higher risk of premature death. Loneliness on its own, the feeling of disconnection even if you're surrounded by people, was independently linked to a meaningfully higher risk as well. Other research has put the effect of chronic loneliness in the same range as smoking a moderate number of cigarettes a day. Let that sit for a second. The World Health Organization has officially named social isolation a public health priority, on the same tier as smoking and obesity. This isn't just sad people get sick more. There's a mechanism. Loneliness keeps your body's stress system, the HPA axis, switched on longer than it should be. That drives chronic inflammation. Inflammation, sustained over years, is implicated in heart disease, stroke, and cognitive decline. And the studies are careful to separate two different things: being alone and feeling alone. You can live with other people and still feel isolated. You can live by yourself and feel completely connected. It's the quality of connection that the data tracks, not your relationship status. Action step: this doesn't require a personality transplant. One scheduled call with a friend this week, one recurring commitment, a class, a team, a group chat you actually show up for. Research on group activities and volunteering shows measurable drops in inflammation markers. Connection is a biological input, not a luxury. Now let's talk about something you're probably eating today that's doing more damage than its calorie count would ever suggest. Tip 6. Ultra-processed food. It's not just the calories. In 2019, researchers at the National Institutes of Health ran an experiment that should have gotten more attention than it did. They took 20 adults, put them in a controlled facility for a month, and gave them 2 diets, matched almost exactly for calories, sugar, fat, fiber, and macronutrients. The only difference, one diet was built from ultra-processed foods, the other from minimally processed whole foods. People could eat as much as they wanted from either diet. On the ultra-processed diet, people ate about 500 more calories a day and gained roughly 2 pounds in 2 weeks. On the whole food diet, they lost about the same amount, same nutrition label, different body. So, what's actually going on? A 2024 study found part of the answer was startlingly simple. People chewed ultra-processed food less and ate it faster, which seems to blunt the signals that tell your brain you're full. Beyond that, a major 2024 review covering data from nearly 10 million people found convincing evidence linking high ultra-processed food intake to a 50% higher risk of cardiovascular death, and highly suggestive evidence linking it to higher rates of type 2 diabetes, obesity, and depression. This isn't about never eating packaged food again. It's about understanding that the NOVA classification system, minimally processed, processed versus ultra-processed, captures something calorie counts and nutrition labels miss entirely: how a food is engineered to override your body's normal stop signals. Action step: you don't need to overhaul your pantry overnight. Pick one ultra-processed staple you eat daily, a packaged snack, a sugary drink, a frozen meal, and swap it for a minimally processed version this week. The goal is direction, not perfection. Here's a habit that fights back against everything we just talked about, and it has nothing to do with the gym. Tip 7. The movement that happens between your workouts. Quick myth to bust: going to the gym for an hour does not cancel out sitting for the other 15. Scientists call the energy you burn outside of formal exercise, walking to the car, standing, fidgeting, doing chores, non-exercise activity thermogenesis, or NEAT, and research has found something counterintuitive. This invisible movement can account for hundreds of calories a day, and a sedentary lifestyle doesn't get fixed by squeezing in one structured workout. One study found that simply interrupting sitting time every 20 minutes was linked to measurable improvements in blood pressure and a 3 to 4% reduction in all-cause mortality risk. Regular movement breaks have also been shown to lower blood sugar spikes after meals, even in people with no metabolic problems at all. The takeaway is almost relieving. Your body doesn't only care about your 1 hour at the gym, it's tracking your entire day. Action step: set a reminder to stand or move for 2 minutes every 30 to 60 minutes during your workday. Take the stairs once today instead of the elevator. Park slightly farther away. None of this replaces real exercise, but it stacks on top of it, and the data says it counts. Now let's talk about the kind of exercise that does the most good as you get older. And it's probably not the kind you're picturing. Tip 8. Resistance training, the closest thing to an anti-aging pill. If there were a pill that reduced your risk of death by 10 to 20%, reduced inflammation, protected your bones, and kept you mobile into your 80s, it would be the most talked about drug on the planet. It already exists. It's called resistance training. A large study from UCLA followed over 200,000 older adults for 15 years. Any amount of weight training, compared to none, was linked to lower mortality risk from cardiovascular disease and other causes. A separate systematic review found resistance training programs were associated with a 10 to 20% lower risk of all-cause mortality, cardiovascular disease, and even certain cancers. Here's a detail that surprised researchers. In one study, older adults who did resistance training for 6 months developed muscle mitochondria, the cell's energy factories, that looked similar to those of people 40 years younger. Resistance exercise doesn't just slow aging in muscle. In some measurable ways, it reverses it. And you don't need to become a bodybuilder. After menopause, women can lose up to 20% of bone density within just 7 years. Strength training has been shown to slow that decline and, in some protocols, build bone back. Action step: 2 sessions a week. Bodyweight squats, push-ups against a wall or counter, resistance bands, light dumbbells. The type of resistance matters far less than doing it consistently. If you're over 50 and have never strength trained, this is, by the data, one of the single highest leverage things you can start. We've covered what to eat less of, how to move, how to sleep. Now let's talk about the one habit most people actively avoid, because it means going to the doctor when you feel completely fine. Tip 9. The screenings that find problems before they become emergencies. Here's an uncomfortable truth. Some of the most dangerous health conditions, high blood pressure, prediabetes, early-stage cancers, often produce 0 symptoms until they're advanced. You cannot feel your cholesterol. You cannot feel stage 1 colon polyps. The U.S. Preventive Services Task Force, an independent panel of medical experts, maintains evidence-graded screening guidelines specifically because catching these conditions early changes outcomes dramatically. Colorectal cancer screening is recommended starting at 45. Blood pressure and cholesterol checks are recommended for most adults, with frequency depending on age and risk. Diabetes screening is recommended for adults 35 to 70 who are overweight or have other risk factors, and yet, surveys consistently find large gaps between what's recommended and what people actually get. Some research has found medical residents themselves only correctly identify recommended cancer screening guidelines around a quarter to half of the time, let alone the general public. This is the least exciting tip in this video. It's also probably the one most likely to add years to your life if you've been putting it off. Action step. Look up the current USPSTF recommendations for your age and sex. They're public at usepreventiveservicestaskforce.org and book the one screening you've been avoiding. This single 5-minute search could be the most consequential thing you do after watching this video. We've saved one idea for last, not because it's the most proven single fact in this video, but because it's the best way to hold everything else together. Tip 10. What the world's longest-lived people actually have in common. You've probably heard of blue zones, regions like Sardinia, Italy, or Icaria, Greece, where unusually high numbers of people live past 100. I want to be straight with you about this one, because it's the most debated topic in this entire video. Some of these regions hold up extremely well under scientific scrutiny. Sardinia's centenarian records have been verified down to individual family genealogies. Others have drawn real published criticism, questions about whether birth records were accurate, and evidence that the longevity advantage in places like Okinawa and Nicoya may not be holding for younger generations the way it did in the past. So here's the honest version of this tip. Rather than treating blue zones as a finished scientific fact, treat it as a real-world illustration of habits we've already covered tonight, each individually backed by its own solid research. Daily walking built into ordinary life, strong social bonds, a mostly plant-forward diet, and movement that never stops, well into old age. The people in these regions didn't optimize their health with apps or supplements. They built environments where the healthy choice was just the normal one. Walking to see friends wasn't exercise, it was Tuesday. Action step. You don't need to move to Sardinia. Redesign one small piece of your environment instead. Walk to one errand you'd normally drive to. Eat one more plant-based meal this week. Schedule one recurring social commitment. Small structural changes beat willpower over the long run. None of these 10 things will make headlines. None of them are a miracle. There's no pill in this video, no supplement, no fad. What there is 20 years of published research converging on the same quiet conclusion. Longevity isn't one big decision. It's the sum of about 10 small, boring, repeatable ones. A grip on a dumbbell, a walk after dinner, a consistent bedtime, a phone call you actually make, a screening you finally book. You don't need to do all 10 tomorrow. Pick one. Start there. If this kind of deep dive science-first breakdown is useful to you, subscribe. We're building a whole series on the research that actually holds up, not just what's trending. Take care of the body you're going to be living in for the next 50 years.